In the last 24 hours, there have been 22,885 new cases diagnosed, with 367 new deaths recorded. This gives a total number of deaths so far from COVID of 45,362. Our reporter Anya Popp joins us from the newsroom. Anya.
Yes, those figures you mentioned are the highest reported daily deaths since May. Now, it's worth remembering that Tuesdays often have higher numbers because of the lag in weekend reportings. But if you compare today to last Tuesday, there's been almost 130 more deaths. It comes as the Office for National Statistics publishes a study today which shows that 2 in 3 people who tested positive for coronavirus said that they didn't have any of the main symptoms, which leaves the obvious point that many people may be leaving the house when they should in fact be quarantining because they don't realise they have the virus. Another study today, another key study, showed that immunity appears to be fading and that it may be possible to catch the virus more than once. The study looked at 350,000 people in England between the months of June and September. And it showed that of those who had tested positive for antibodies, over a quarter of those tested negative for them by the end of that study. And of those in the loss, the loss was greatest for those over the age of 65 and those who have been asymptomatic. But for healthcare workers, the antibodies remained relatively high, and researchers think that that's because of their regular exposure to the virus. And after all of that, a little bit of encouraging news from the Oxford vaccine trial that many people are pinning their hopes to. They've reported a strong immune response from adults of all ages. There was some fears that the vaccine may not be as effective for older people, but that's now been proven not to be the case. The Health Secretary said today he didn't know exactly when a vaccine would be available, but he expects it will be in the first half of next year.
Anya Popp. Joining me now is Mark Jitt, Professor in Vaccine Epidemiology at the London School of Hygiene and Tropical Medicine and a member of the government's SAGE subcommittee on modelling. Professor, if we have 367 deaths being reported in the last 24 hours, what does that tell you about the trajectory of coronavirus right now?
Well, every one of these deaths is a tragedy, but I think this trajectory is what we're expecting. We've seen cases go up for a number of weeks. We've seen hospital admissions go up for a number of weeks. Deaths are always a bit lagging behind, but eventually they will catch up with us. And what we are seeing now is deaths are catching up with it.
Right, so does that mean that the lockdown measures that we're going through, these 3 tiers, are not working?
Well, I wouldn't say they're not working because cases are rising more slowly than they were in March. So they're having some effects, but it seems like they're not having enough of an effect because we don't want cases to rise slowly. We need cases to drop. So it seems that we need to be doing something more.
So does that mean a circuit breaker is still very much on the agenda for people like you as the only way to actually get cases down?
Well, I wouldn't say that there's one way to bring cases down, but I think some measure needs to be put in place. And well, there are a number of different measures that people can do on a daily life, and there are a number of measures that maybe we have to do in society in order to reduce the number of people going out, mixing with other people.
So what are the alternatives to, a full lockdown that might work?
Well, we've seen in many places in the world measures such as extensive testing and high use of face coverings work, but these have to be accompanied, first of all, by some measures in order to bring the cases down from the very high numbers we're seeing. Once we've brought them down, it might be possible to actually put in measures that we can do in our daily lives in order to keep the number of cases low.
Okay.
At the moment, with cases,
sorry to cut you off. I just wanted to ask you briefly about this antibody news that we've seen. Does the fact that people who've had antibodies then lose them after a few months means that they lose immunity, or is that yet to be proven?
Well, that is yet to be proven, although we do know we have evidence that some people can get COVID more than once, although we've only seen a few people who have got it, so this might be rare. the antibodies are usually a marker of protection, but we've also seen, well, some evidence that suggests other parts of the human immune system might also be working even when we can't detect antibodies, like T cells, for instance, which also prime the immune system when they detect the virus. Some people lose antibodies to the coronavirus, but they still have activated T cells, which are doing something. But we don't really understand how the immune system responds to coronavirus yet, so we don't really understand the full implications of this quite rapid waning of antibodies that the REACT study is showing.
Yes, so I think the question that all of this raises is, are we seeing the emergence of a powerful new political faction within the Conservative Party? We know the influence, of course, that the European Research Group has exerted over the past few years. Today we saw the first big intervention from the Northern Research Group. Conservative MPs across the north of England flexing their muscles today, putting pressure on the Prime Minister to deliver on his levelling up agenda. Now, it's a substantial group. Over 50 MPs signed that letter, so it's in Boris Johnson's interest to keep them happy. At the moment, they're being very polite. It'll be interesting to see, though, if that continues, or if they don't get what they want, could they start to cause real political problems for the Prime Minister?
A town built on tourism. Blackpool is usually bustling at this time of year. Now it's in Tier 3 lockdown and the tourists are staying away, leaving businesses on the brink.
If they close us down again, certainly many of the businesses in this area are not going to reopen.
At this family-run cafe, takings are down and tables are empty.
This is an area where people really are cut to the bone, and what jobs they are low paid, low skilled jobs, and we don't see that Blackpool can survive if we don't get our tourist trade back online, if we don't get our small businesses back working, if we don't see a future for our children, then we don't see Blackpool surviving.
Blackpool and places like it are the left-behind towns on which Boris Johnson's majority is built, and he has pledged to put reducing regional inequality at the heart of the pandemic recovery.
The indefensible gap in opportunity and productivity and connectivity between the regions of the UK to unite and level up.
Now over 50 of the region's Tory MPs are saying that he must keep his promise. In a letter, they call for a northern economic recovery plan that will make clear when lockdown measures will end, accelerate big infrastructure projects like high-speed rail and broadband, and use the Chancellor's one-year spending review to support jobs and growth in the region.
There's a lot of elderly people here.
Sentiments supported by Blackpool North MP Paul Maynard.
Is the levelling up agenda in danger of being forgotten in the pandemic?
So we're very conscious of the MPs that we have a promise we made to our constituents to deliver on. And just today we've had £39 million invested in regenerating Blackpool through the Towns Fund. That doesn't mean we can stop though. We may be levelling up infrastructure, we still need to level up individuals and families as well. So there's an awful lot more to do, and I will always encourage the government to do as much as it can.
Back in the cafe, they're not convinced.
We're feeling that there's a disparity between the north and the south, and we understand that exists, there's no question of it. But during COVID, that has become far more noticeable.
And Boris Johnson has previously said he will close that gap. Do you think he will?
No, I don't think so.
I can't see it happening in my lifetime. If our son's lucky enough, it might do, but at the moment, the way things are going, and like I said, the financial snowball is probably going to take his future away.
Amid the COVID clouds, it's now up to the Conservatives to deliver on that bright future they promised here before the pandemic. If they don't, it could be their future that is in doubt.